Hi everybody, my name is Angel, and this video is about brachial plexus. We will study brachial plexus in our classrooms. Let's find out what brachial plexus is about. Okay, brachial plexus is very important for all the students clinically. So let's go ahead and start understanding what brachial plexus is in general. Okay. So the brachial plexus is a fascinating and vital network of nerves. That's why it's called as plexus. That originates from the spinal cord in the neck and travels from the shoulder to the arm and hand. It's responsible for sending signals that control muscle movements and sensations in the upper limb. Okay, so it is responsible for sending signals and control muscle movements and sensations in the upper limb. Yep. So roots, trunks, division cords, and branches make the brachial plexus. So roots are 5 spinal nerves, C5, T1. You will see C4 used at certain location, but it's usually C5. Trunks are upper, middle, and lower. Divisions are each trunk splits into anterior and posterior divisions. So on the ventral side and the dorsal, the front and the back. Cords are lateral, posterior, and medial. Okay. Branches, these give rise to major nerves like musculocutaneous nerve, median, ulnar, radial, and axillary nerve. Injuries to brachial plexus can range from mild, like a stinger in sports, to severe such as nerve tears from trauma. Symptoms might include weakness, numbness, or even paralysis of the arm. The brachial plexus is a network of nerve formed by anterior rami of the lower 4 cervical nerves and first thoracic, right? C5, C6, C7, C8, and T1. As you can see right here, this is the brachial, right? This part here is the axillary region, yeah? And this plexus extends from the spinal cord through the cervical axillary canal in the neck, over the first rib, and into the armpit. It supplies afferent and efferent nerve fibers to the chest, okay? Shoulder, arm, and forearm, right? So as you can see right here, this is the axillary region, okay? So one, as you can see, goes here. Another ones are coming here. As you can see, this M shape, okay? M or W shape that we usually use in the cadaver lab. All right, so you can use the mnemonic for brachial plexus. Rabbits take donuts claiming bravery. So this is a rabbit with the donut and the medal of bravery, okay? So rabbits, root, trunk, divisions, claiming is cords, and B is branches, yeah? So rabbits take donuts, claiming bravery, okay? Plexus is divided into 5 roots, 3 trunks, 6 divisions, 3 anterior, posterior, 3 cords, and 5 branches. There are 5 terminal branches and numerous other pre-terminal or collateral branches such as subscapular nerve, thoracodorsal nerve, and the long thoracic nerve that leave the plexus at various points along its length. A common structure used to identify part of the brachial plexus in cadaver dissection is the M or W shape made by the musculocutaneous nerve, lateral cord, median nerve and medial cord, and ulnar nerve. Okay, the 5 roots are the 5 anterior primary rami of the spinal nerves. After they have given off their segmental supply to the muscles of the neck, the brachial plexus emerges at 5 different levels: C5, C6, C7, C8, and T1. C5 and C6 merge to establish upper trunk. C7 continuously forms the middle trunk, and C8 and T1 merge to establish the lower trunk. The prefixed or postfix formation in some cases involve C4 or T2 respectively, right? So this is C5, C6, C7, C8, and T1. Superior, middle, and inferior trunks. Divisions lateral, posterior, and medial, right? The main branches are musculocutaneous, axillary, median, radial, and ulnar. All right, roots are dorsal scapular nerve, comes from the superior trunk. As you can see, this is the dorsal scapular nerve, and innervates the rhomboid muscles, which retract and downwardly rotate the scapula. Okay, they're in the back. Okay, The subclavian nerve originates from both C5 and C6, right? So subclavian nerve originates from C5, C6, innervates the subclavius nerve to subclavius right here. A muscle that involves lifting first ribs during respiration. The long thoracic nerve arises from C5, C6, and C7. This nerve innervates the serratus anterior, which draws the scapula laterally and is a prime mover in all forwarding, reaching, and pushing actions, right? So as you can see, these are roots, C5, C6, C7, C8, and T1. This here is a long thoracic nerve, right? This one. This red line here is the part where we call a trunk. Now, this nerve over here goes to dorsal scapular nerve in the back. This is suprascapular nerve, right? This is nerve to the subclavius, right? Subclavian nerve. These are lateral pectoral nerves, right? Lateral pectoral nerves, where pectoralis minor and major. This is lateral cord. This is posterior cord in the back, and this is the medial cord in the middle, okay? Here, this is the upper subscapular nerve. This is the medial pectoral nerve, all right? These are thoracodorsal nerve. This happens to be the lower subscapular nerve. This happens to be in the middle. That is radial nerve, okay? Now, as you can see, the one that arises from posterior cord one is axillary nerve. This is musculocutaneous nerve, right here. This is the median nerve. This is ulnar nerve. This is medial cutaneous nerve of the forearm, right? And here, as you can see from the medial cord, you have medial cutaneous nerve of the arm, okay? From the lateral cord, you have musculocutaneous nerve, right? And as you can see right here, from the lateral pectoral nerve, you see right here, and you also see a medial pectoral nerve right here. Okay, so you have to draw it out at least 10 to 20 times to understand what is actually going on. Once you do it, I think you will remember it perfectly, but you have to keep drawing it again and again and again to understand all these nerves, okay? So first, this is what I did. I started making a skeletal framework, you know, the one that I showed you before, and then I came to the second page and I did at least 20 times to remember it, and you can do it too, okay? Trunks, these roots merge to form trunks. Superior upper C5, C6, middle is C7, inferior lower C8, T1, first thoracic vertebrae. Each trunk then splits into two to form six division, anterior division of the upper, middle, and lower trunks, posterior divisions of the upper, middle, and lower trunks. When observing the body in the anatomical position, the anterior divisions are superficial to posterior divisions. The sixth division regrouped to become the three cords of large fiber bundles. The cords are named by the position with respect to the axillary artery. The posterior cord is formed from the three posterior divisions of the trunk C5, C8. The lateral cord is formed from the anterior division of upper and middle trunk C5, C7. The medial cord is simply a continuation of anterior division of the lower trunk C8, T1. Branches. Most branches arise from the cords, but a few branches indicated in italics arise directly from earlier structures. The five on the left are considered terminal branches. These terminal branches are the musculocutaneous nerve, the axillary nerve, the radial nerve, the median nerve, and the ulnar nerve. Due to both emerging from the lateral cord, the musculocutaneous nerve and the median nerve are well connected. The musculocutaneous nerve has even been shown to send a branch to the median nerve, further connecting them, right? There have been several variations reported in the branching pattern, but these are very rare, all right? The five on the left are considered terminal branches. These terminal branches are the musculocutaneous nerve, the axillary nerve, and the radial nerve, okay? So these are the main five terminal branches. And from there, you have multiple different branches as well, okay? All right, so from the roots we have nerves, all right? What are the roots? We have, and what are the muscles, right? And what is the cutaneous innervation too? So we have dorsal scapular nerve, which is C4, C5. rhomboid muscle, and levator scapulae, yeah, on the sides, lateral sides of your neck. So we have long thoracic nerve, that is C5, C7, C6, C7, serratus anterior. We just saw the long thoracic nerve. And the branch to phrenic nerve, which goes to diaphragm, yeah, C3, C4, C5. Nerve to subclavius, C5, C6, subclavius muscle. Suprascapular nerve, C5, C6, supraspinatus and infraspinatus. Lateral pectoral nerve, C5, C6, C7, which is pectoralis major, pectoralis minor, right? Musculocutaneous nerve, coracobrachialis, brachialis and biceps brachii, C5, C6, C7. Lateral root of the median nerve, C5, C6, C7 fibers to the median nerve, alright? Now, the musculocutaneous nerve becomes lateral cutaneous nerve for the forearm and innervates the skin of the anterolateral forearm elbow joint, okay? Alright, the posterior cord, upper subscapular nerve, subscapular is upper part, C5, C6, and we have thoracodorsal nerve, C6, C7, C8, latissimus dorsi in the back. Lower subscapular nerve, C5, C6, subscapular is lower part, and teres major, okay? Axillary nerve, C5, C6, anterior branch, deltoid, and a small area of overlying skin. Posterior branch, teres minor, deltoid muscles. Radial nerve, C5, C6, C7, C8, T1. Triceps brachii, supinator and conius and extensor muscles of the forearm, and brachioradialis. Medial cord, medial pectoral nerve, C8, T1, pectoralis major and pectoralis minor. Medial root of the median nerve, medial cord, C8, T1. All of the flexors in the forearm except flexor carpi ulnaris and their part of flexor digitorum profundus that supplies the fourth and the fifth digits, first and second lumbrical muscles, muscles of the thenar eminence by a recurrent thenar branch. Portions of hand not served by ulnar or radial, skin of the palmar side of the thumb, index and middle finger, half the ring finger, and nail bed of these fingers. Medial cord, medial cutaneous nerve of the arm, C8, T1, front and medial skin of the arm. Medial cord, medial cutaneous nerve of the forearm, C8, T1, medial skin of the forearm. Medial cord ulnar nerve, C7, C8, T1, flexor carpi ulnaris, flexor digitorum profundus, intrinsic hand muscles, thenar muscles, lumbricals of the hand, which are served by the median nerve. The skin of the medial side of the hand, the medial 1.5 fingers on the palmar side, and medial 2.5 fingers on the dorsal side. What is the function? The function is brachial plexus provides nerve supply to the skin and muscles of the arm, with two exceptions: trapezius, supplied by the spinal accessory nerve, and an area near axilla supplied by intercostal brachial nerve. Brachial plexus communicates with sympathetic trunk via gray rami that join the plexus roots. The terminal branches of the brachial plexus, musculocutaneous nerve, axillary nerve, radial nerve, median ulnar nerve, all have specific sensory, motor, and proprioceptive functions. Right? So now this will actually help you remember more. This area here, supraclavicular, is 3C4. Supralateral brachial cutaneous for axillary regions right here. This is radial inferior lateral brachial. This is radial posterior brachial cutaneous. This is musculocutaneous, right? Here is radial superficial branch right here, this little dot. These are palmar branches, and this here is palmodigital branch. The middle finger, as you can see, is median C5, C8, okay? This is the anterior region, this is the posterior region, yeah? So here, this is medial antebrachial cutaneous, medial brachial cutaneous C8, T2, intercostal brachial T2, radial posterior brachial cutaneous, inferior lateral brachial cutaneous, posterior anterior brachial cutaneous, lateral antebrachial right here on the green, radial superficial branch C6, C8, dorsal distal right here. This is the dorsal. This is a proper palmar distal. Okay. All right. So C5, C6, C7, C8, superior, middle, and inferior. These are the roots. This middle here is the trunk. This is the anterior and posterior side. lateral cord, posterior cord, medial cord, and these are the cords. There's a cadaveric section, okay, where you can actually understand how it actually, is in realistic life, not in animated life, okay? This is musculocutaneous nerve. This here is axillary. This is radial. This is axillary artery. This is median nerve, and this is ulnar, right? All right. So whenever a nerve goes through axillary region, it's called as axillary artery, and then it changes into a different nerves, different names of the nerves when it goes to different regions. Okay. All right, again, this is a very good image if you want to remember it. Yeah, you can actually go through and create diagrams from it. Long thoracic nerve, you have superior, middle, inferior, you have nerve to subscapularis, suprascapular. Again, you have superior subscapular nerve, then you have thoracodorsal, inferior nerve, right? You have axillary right here. These are all the medial. This is medial, anterior, inferior, right? This is medial anterior and this is posterior. Medial pectoral, medial cutaneous nerve of the forearm, ulnar, radial, medial, median, and musculocutaneous. All right. This is actually a very good diagram. If you want to learn from this, that would be nice. This is the contribution to phrenic, which goes to diaphragm. All right. Lateral cord, posterior cord, medial cord. This here is musculocutaneous nerve. This here is the radial nerve. This here is the median nerve, right? This is ulnar nerve. This is medial cutaneous nerve of the arm. This is lower subscapular nerve right here. This is thoracodorsal nerve. This is long thoracic nerve. Goes in the back, right? We saw C5, C6, C7, right? These are all the lateral, posterior, and medial cords right here, okay? This is the artery, axillary artery. All right, now this is the similar kind. This is on the anterior region. As you can see, these are the roots. The blue ones are the trunks. These are all the anterior divisions. All right, now the green ones are posterior cord divisions in the back. This one here is the cords, as you can see. Terminal nerves in the pink. These are the terminal nerves, terminal branches, and then we have nerve branches. We have terminal and then we have branch. Okay. And what are the types of nerve damage? So as you can see, this is a spinal cord. This is an avulsion, breakage. Okay, this is a stretch. You're breaking it when you're stretching it. And this is rupture. This is just rupture. Part of the spine shows how the nerve roots connect to the spinal cord. The most serious types of nerve injuries are an avulsion fracture, where the nerve roots are torn away from the spinal cord, and rupture, where the nerve is torn into two pieces. A less serious injury is stretching B of the nerve fibers. Causes brachial plexus injuries in the upper nerves happen when the shoulder is forced down on one side of the body and the head is pushed to the other side in the opposite direction. The lower nerves are more likely to be injured when the arm is forced above the head. Alright, so contact sports, many football players have burners or stingers. These are caused when the brachial plexus nerves get stretched past their limit during clashes with other players. Birth newborns can have brachial plexus injuries. This is more common in babies with a high birth weight. A very long labor and a bottom first, also called breech presentation. If a baby's shoulders get stuck in the birth canal, brachial plexus palsy is more likely. Most often, the upper nerves are injured. This is called erbspalsy injuries. Okay. So damage to C5, C6. Forward rotated shoulder, upper arm redness, muscle atrophy, water lip, deformity of the wrist. This is bird winging of scapula right here, right? As you can see, scapula is protruded outside. Drooping eyelid, ptosis, and a smaller pupil right here. What's called Horner syndrome. Okay. All right. So how do we fix brachial plexus injuries? What kind of surgical intervention can be done, right? The patient's right extremity, right here, right extremity, was held with shoulder internally rotated, elbow extended, wrist flexed, and forearm pronated. She demonstrated excellent tricep strength but had no biceps function. Okay, so we have triceps that are intact. but there is no biceps function. Okay, so now we know which nerve is impacted. So triceps are intact. C5, C6 is the one that's giving trouble. Okay, moreover, she did not exhibit shoulder elevation or active wrist extension, right? So we have extensors that are problematic. We have shoulder elevation. Okay, so is it deltoid? Is it supraspinatus? The patient was referred to occupational therapy and splinting with surgery ultimately deemed necessary. Upon exploration of the right brachial plexus, the C6 nerve was found to have significant scarring and lack of stimulus conduction. There was contractility of deltoid with stimulation at 2 milliamperes of C5 proximally. Okay, so C5 was still contracting, but no contractility with stimulation of C6. Okay, so when they stimulated C5, they could see there's a little bit of contraction, but in C6 they did not. The team proceeded with a procedure that included neurolysis of the brachial plexus and double fascicular nerve transfer. So there was a nerve transfer that actually took place, yes? As you can see, they tried to contract it, and they could see there was contraction in C5, but not in C6. Okay. A 2-year follow-up, the patient demonstrated significant improvement. She had regained shoulder elevation about 130 degrees shoulder elevation. So we not only have supraspinatus that is 15 degrees first, and then deltoid taking over. So you could see we have an elevation. Full passive shoulder external rotation, negative clarion, active elbow flexion, supination to 10 degrees, no elbow flexion contracture, and some active extension of the wrist. So we could see the wrists are functioning, no elbow flexion contractions. We have issues with elbow still, and active elbow flexion, supination 10 degrees, right? But then again, we have issues with flexion contracture. Okay, so as you can see, brachial plexus injuries are very complicated, and there's actually a follow-up of 2 years to have like a real time improvement. Okay, so be careful when you're doing it. Many injuries, including those from the motor vehicle accidents, motorcycle accident, falls or bullet wounds, can damage the brachial plexus. Tumors and cancer treatments. Tumors can grow on their own. Rarely they can form because of a health condition such as neurofibromatosis or after radiation treatment. Okay. Alright, so if you like this video, please like, subscribe, share, and comment. Please don't forget to draw brachial plexus multiple times and keep reading them. If you can have a table, with the list of, let's say, muscles, innervation, insertions, their origin, their bus supply, and their function, that would be excellent because that's how you'll remember which nerve innervates what. And you have to keep reading them again and again. You can also have flashcards that you can create that would help you. I personally created a table format, and I also had flashcards, and they both helped me. Active memory recall is going to be very helpful to you. Okay, bye.